Hello, good morning. Welcome to our Ontario network of CAPCHP projects network annual presentation. We're really delighted to have you all here, those who are in the Zoom room with us this Thursday, June 4th. Is that right? And also any of you who might be watching the recording, really great to have you join us. My name is Sydney Bell. I'm the network program lead and I work out of Camino Mental Health and Wellbeing in Kitchener-Waterloo. And as we begin our time together today, I'd like to take a moment for us to pause and acknowledge the many territories across Ontario where our network members are joining from today, and especially the long-standing relationship that First Nations, Inuit, Métis peoples that they have with these lands. Our network, as I mentioned before, the sponsor agency is Camino Wellbeing and Mental Health, which is in Kitchener, located on the traditional territory of the Haudenosaunee, Anishinaabe, Neutral Peoples, and within the Haldimand Tract. And with that acknowledgement of land and stewardship, again, I'd like to welcome you to our network's annual presentation to our funder, Public Health Agency of Canada, and to our network members who are joining us today. With me in hosting this event is Stephanie Brozo. She's a co-chair with our coordinating committee. And so I'm going to pass it over to Stephanie to say a few words.
Yes, hello everyone. Good, I guess it's afternoon, maybe morning for some folks, and welcome. So, as Sydney said, my name is Stephanie Brazo, and I'm the Director of Family Services with Our Children Our Future here in the city of Greater Sudbury. And as Sydney mentioned, the co-chair of the coordinating committee. I'd like to thank everyone for joining us today, especially our representatives from Public Health Agency of Canada, our project teams, and of course, network partners. And I see a lot of members of our coordinating committee here as well. So welcome, everyone. So today's presentation provides an opportunity to share reflections on the past year across the network. So we're going to be sharing some highlights, key accomplishments, emerging learnings, and discuss what we're hearing from members as we begin thinking about sustainability and future planning beyond 2030. So we're grateful for the ongoing partnerships and, of course, the support from Public Health Agency of Canada. And we look forward to the discussion following the presentation. So thank you for being here, and I'm going to flip it back to Sydney.
Yes, I think we wanted to start our time here today with a quick little Zoom poll just to get a sense of who is in the room in terms of what zone you're joining in from, what role you play in your CAP CHP program. So hopefully you can see the poll up there. And please just take a moment to tell us a bit about who you are and where you're joining from. We'll just give it another couple of seconds. Okay, let's see, what do we have? Are you seeing the results? I assume you are. Yeah, okay. So we've got a good percentage of people here are working in organizations with both programs, and then a pretty even split between the two streams. And lots of program facilitators. Great to have you here. Home visitor, shout out to home visitors. I think they do such great work. Yeah, and some fact staff, admin supervisors. That's great. And also an even split of length. But look at the number, 25 plus years is the greatest
Mm,
percentage at 33% of folks
mm,
in the room.
amazing.
What does that tell you? That really speaks to some dedication and passion for this work. And zones, not that it's a competition, but Central Zone might be winning in terms of participation at this event. That's awesome. It's great to see folks also here from East Zone and Southwest Zone. And if you're somebody who doesn't know and would like to know, feel free to reach out to me, send me an email. We'll figure out what zone you belong to and get you connected to those resources. Okay, thank you for sharing. It's great to again have you all here. Now, what were we going to do after this? I was going to take a moment to once again acknowledge our guests who are joining us from Public Health Agency of Canada. They'll have some time at the end to share some comments, but I see Tim is here. Maybe give a wave, Tim Edis, Rosetta Ramos, I see. And I did see Olga and Jessica are here as well. Welcome. Hi, Jessica. And is there anybody else here that I
Blanca?
missed? Oh yes, Blanca, of course. Blanca is just part of she's just part of the group. She's a special guest, but she's just part of us. Welcome. And I also wanted to acknowledge I see lots of coordinating committee members here. Katrina, give a wave. Nicola, Yvette, Nettie are on screen. Welcome. Rachelle Peltier, welcome, is here. And
Krista, but she's off screen, I think.
yes, right. Anybody else that didn't miss? I think I think that's about it. And thank you for your time and all that you offer to our network by participating on our coordinating committee. So I think that's going to take us right into the presentation that Stephanie and I have prepared. And feel free to pop questions in the chat. We'll probably answer them more at the end so we can make sure we get through what we've prepared in a good amount of time, and then we'll have a discussion and really welcome any comments or questions. So I'm going to get set up here. I think I did it. Yeah. Does that look good,
Perfect.
Stephanie?
Yeah, it looks good.
Okay. Just get myself set up, and I think we're starting with you, Stephanie,
Mm-hmm.
if I've got it right.
Absolutely. Thank you, Sydney, for that. And I'm going to be reading a little bit because if I don't, I get really passionate about this stuff. So if I don't read, I'll go off onto tangents and we'll be here all day. So I'm just going to preface that. If you could flip to the first slide, that would be great, Sydney.
This year?
All right, what happened this year? So, before reviewing the data and outcomes, we like to take a moment to acknowledge the broader context in which projects in the network have been operating this year. So it has been a period of significant change, both for the network and for local projects serving families across Ontario. Despite those challenges, members continue to demonstrate resilience, innovation, and commitment to supporting children and families in their communities. So if you could flip to the next slide, Sydney. All right, so this year represented a unique moment for the network. It marked the final year of the previous funding cycle while also preparing for the transition to the newly named Community Action for Prenatal and Child Health program. So at the same time, conversations about sustainability beyond 2030 became more prominent. Across Ontario, projects continue to navigate staffing pressures, increasingly complex family needs, administrative demands, and uncertainties about the future. So these realities shape both participation in network activities and the types of supports members told us they needed the most. Next slide, Sydney.
Okay, I think I'm taking over here for a bit.
Yes.
And I'm really pleased to share some of our key highlights from this past year, and really what you can see in terms of the events, the learning circles, the provincial conference. We've got the numbers of attendees there on the slide. The work we did growing our resources, our online archive and knowledge center, and some of the work we're doing to really focus and cultivate spaces for Indigenous-based projects that what we really saw was participation patterns really varied across our activities. And we see the strongest engagement in offerings such as webinars. Our newsletter is quite popular, and our annual provincial conference. And activities requiring greater time commitment, those types of activities see more variable participation. And so it sort of gives us a bit of an insight where members are finding value in our network offerings. So here you see some of what our evaluation suggests where the strongest participation is happening, our webinars, newsletter, and conference. More variable participation happens in Zoom meetings and learning circles and on web connects. And what we're really seeing when we connect with network members is they want to stay engaged and connected. And what's really important to them are flexible and accessible opportunities. Those are the opportunities that consistently attract the most participation. So things like today's event or a webinar that get recorded and then are able to be accessed at times that are convenient to network members are very popular. And really what this seems to indicate to us is that any barriers to participation aren't, it's not interest, but rather capacity and workload. Everybody's just really very busy. So again, engagement is strongest when our opportunities are flexible, accessible, low barrier, and available asynchronously. Really, what we want to kind of share and reflect on here is that our network is more than just a series of activities. It serves as a connective infrastructure across Ontario. We support projects to share information, to learn from one another, reduce duplication, and respond quickly to emerging issues. When we were in the midst of the pandemic, COVID really highlighted the value of a coordinated communication and collaboration system, such as what the network offers. And the funding, the investment from PHAC really sort of enables and supports the coordination and responsiveness, not only sort of day to day, but in times of crisis. Which really, invites us to think, and we invite you to think about the role of the network. And what I'm sharing with you here summarizes what members shared with us through surveys, evaluations, and conversations, and how we really support our projects through being able to respond quickly to emerging needs, sharing knowledge and resources efficiently, strengthening continuity for families across community. That is an ultimate impact. Yeah, I think that's all I want to say about that. And I think we'll move on then to the next slide, which I believe we're going back to Stephanie.
Yeah, thanks, Sydney. So the next section focuses on what we learned through member engagement, feedback, and participation throughout the year. So all the examples that Sydney just provided for us, there was a lot of opportunity to hear about what members want. So while participation data tells just part of the story, member feedback provides important insight in how the network is supporting projects and where opportunities for improvement may exist moving forward. So if you could go to the next slide, please.
Sure.
All right, so what are members telling us? Members consistently describe the network as a valuable source of information, learning, and connection. So what was highlighted was the practical tools, peer learning opportunities, timely updates as some of the most beneficial aspects of participation. So what stood out mostly and strongly, however, was the importance of relationships. So this was a common theme that kept on coming through. Many members spoke about feeling less isolated and more connected to others, facing similar challenges. So that came through, I think, the most in the feedback is that connectivity and the relationships. For many projects, knowing they're part of a broader community of practice provides reassurance, encouragement, and opportunities for shared problem solving. Next slide, please. So, alongside the positive feedback, several important tensions emerged. So, members clearly value the network activities, but many are experiencing significant capacity pressures that
Mhm.
make participation challenging. We also heard that while some members feel highly connected, others are still looking for ways to build stronger relationships and access supports. Communication obviously continues to be important, but barriers such as information overload, competing priorities affect how consistently members receive and engage with the information. So these findings remind us that maintaining connection requires ongoing attention to accessibility, flexibility, and being responsive. Next slide, please. So this slide brings together many insights that emerged across the year from, again, participation data. We've heard from members' feedback and observation as a network. So first, flexibility matters. We consistently saw stronger engagement when opportunities were easy to access. We offered it in multiple formats and allowed members to participate in what fits their schedule and capacity. And I believe Sydney gave some examples earlier, just especially for example, today's
Mhm.
session's being recorded. So
Mhm.
that's an example of being more flexible. If someone couldn't come today, they could watch it later. Second, the connection functions as infrastructure. Members describe the value of the network not only in terms of learning opportunities, but also in the relationships, reassurance, and shared problem solving that happen through ongoing connection with colleagues across Ontario. We also heard a clear desire for practical support. So, projects are working in increasingly complex environments and value resources, tools, and examples that can be applied directly to their day-to-day work. So another important insight is that meaningful connections doesn't happen by accident. Intentional facilitation and dedication, coordinated play an important role in creating opportunities for collaboration, knowledge sharing, and relationship building. And again, as you can see, this is a theme throughout, is the connection and the relationship building. So finally, future planning is becoming increasingly important as conversations about the transition beyond 2030 continue. Members are thinking about sustainability, continuity, and what supports will be needed moving forward. So together, these insights help guide our priorities and planning for the coming year. Back over to you, Sydney.
Thank you. And so, yeah, the coming year, what can we sort of take from what we've learned and our experiences in the past year and bring it forward into our work, this first of a 4-year work plan? And again, with the context that projects are experiencing significant pressure, burnout, staff turnover, increasing complexity of needs, administrative burden, many folks just wearing a lot of hats in their projects, and uncertainty about the future, especially with the changes in the program structure and moving into a competitive process in 2030. So these pressures are being felt across many communities, and without strong support structures, program capacity may become more fragile. And then, of course, there's the ultimate impact on the families and communities that we all serve. So the thinking a little bit on emerging risks and pressures, thinking about that a little more. Our coordinating committee and our network is looking for ways that we can improve communication and access to information within our scope of influence. We work to continue to be offer flexible engagement opportunities, to create more opportunities for peer connection and increase the visibility of project innovations and successes. Just love having those kinds of opportunities, and focus on what members have identified as most useful. So in terms of priorities, the coordinating committee has begun discussing and planning intentionally for 2030, which is sort of a big year for CAPCHP projects moving to competitive funding model, but also the reality of the network no longer being here. It will not exist in its current form, as non-service delivery projects will no longer be funded after 2030. So with members consistently identifying the value of connection and shared learning, knowledge exchange, and collaborative problem solving, we're wrestling with these questions of what functions are the most essential. What should be sustained somehow, some way past 2030? And how can projects continue to feel connected and supported in that landscape? Ooh, okay, so that sort of highlights a little bit of what I was just sharing. What core functions of the network are most essential? What relationships and structures need to be sustained, and how will that be sustained? What will that look like? How can we support projects both through the sunsetting of the network and through their own challenge of preparing funding proposals for a competitive uh, funding process? Okay. I, I feel like I've mucked things up here, Stephanie.
That's okay. You're a slide behind. You're good though. This is
I
you're good.
know.
You're good.
Is this where you are taking over?
Yes.
Okay,
Yes.
good.
Thanks, Sadie. Um, so this following slide highlights some of the functions that coordination currently makes possible. So many of these activities happen behind the scenes, but they are essential in keeping projects connected and informed. So coordination supports communication, learning opportunities, relationship building, knowledge sharing, and ongoing dialogue with the Public Health Agency of Canada. So, as we look beyond 2030, an important consideration is how these functions will continue and where responsibility of them may ultimately reside. Next slide, please.
Oop, there you go.
So, this is very important. I like to highlight the importance of the network program lead in supporting the day-to-day work of the network. So, in our case, that role is filled by our very own Sydney, who is helping me facilitate this presentation today. Yes, thanks, Glashad, for the hearts. Well, most of this work happens behind the scenes, as mentioned. It's essential to keeping the network connected, organized, and responsive. Sydney, as a network program lead, coordinates communication across projects, supports meetings, learning opportunities, shares resources and information, and helps maintain relationships with projects, partners, and the Public Health Agency of Canada. So, as co chair, I can say firsthand that having a dedicated network lead has been invaluable. If I could bold that part in that sentence, I would. The coordinating committee provides leadership and direction, but it would be much more difficult to provide priorities and moving forward to maintain this level of coordination without someone dedicated to bringing all these pieces together, which we have that in Sydney. So Sydney's role helps turn ideas into action, ensures that the work of the network happens consistently across the province. It is this dedication, coordination capacity that helps create the condition for collaboration and shared learning and meaningful connections amongst the projects. So the value of this role isn't just in organizing activities, it is helping sustain the relationships, the communication, and infrastructure that allow the network to function effectively. Next slide, please, Sydney. So one of the clearest messages we heard throughout the year is that, again, connection matters. So relationship building is often viewed as an added benefit, but members consistently described it as essential to their work. Strong connections help projects reduce isolation. We share solutions, respond more quickly to emerging trends, and learn from another's experiences. So ultimately, these relationships strengthen local programs and improve the support available for children, families, and communities across Ontario. So this is why connection should be viewed not as extra, but as critical infrastructure that supports the effectiveness of the entire network. Next slide, please. So as we look ahead, the past year has reinforced the important role of the network plays in supporting connection, learning, coordination, and collaboration across Ontario. So while the environment continues to evolve, one thing remains clear. Projects value opportunities to come together, share knowledge, learn from another, and work collectively to address emerging challenges. So as we prepare for the transition beyond 2030, the coordinating committee is committed to supporting a thoughtful and responsible planning process. This includes identifying what has worked well, understanding what may be at risk, and exploring how the strengths and lessons of the network can continue to inform future approaches to collaboration and to support. So the network is more than a collection of activities or events. It's a model that has helped projects stay connected, responsive, and better equipped to support children, families, and communities across the province. So, on behalf of the coordinating committee, I thank you to the Public Health Agency of Canada for your ongoing partnership and support. Thank you to all the network members for your engagement, leadership, and commitment throughout the year, and to the coordinating committee members as well. We look forward to continuing these conversations together. So at this point, I'll hand it back over to Sydney and open up the floor for any questions and discussions.
That's awesome. Thank you, Stephanie. We wanted to keep it, short and sweet. This gathering we've always tried to keep within an hour. So that's what we have to share in terms of, reporting to you all about our thoughts of how things went last year and what we're prioritizing and looking to really focus on in for sure, like the year ahead and our next 4-year work plan. So we do definitely have time for some questions and conversation. I do want to again acknowledge Tim here as the official representative from Public Health Agency of Canada, and certainly welcome any questions or comments that you might have, Tim. So maybe I'll pass the microphone, as it were, over to you.
I should really turn it over to Blanca. She's much more knowledgeable than me, but I will say the network, I mean, it's great. We appreciate seeing all the slides and to understand the work of the network. Probably would be good to share these. I'm sure you will. But I just see it as the project to project support and mentoring that the network provides is invaluable because we as consultants may send out, hey, here's the ISFR, apply for this funding. But then I remember last year, even when you were doing the needs assessment, and I know everyone collaborated together to say, well, what do they want really from this needs assessment?
Mhm.
And that peer-to-peer support, I mean, for the participants, but also for projects themselves, I think is so important. The intel information sharing for each other, but also for PHAC, because intel is so important to the agency and public health issues evolve over time. So it's great to be able to get that strong communication of what you're seeing on the front lines. I appreciate all the events, the learning circles, web connects, and Stephanie mentioned it, but Sydney, like, you go to any of those events and your whiteboard and you're used to the polls and keeping it active, it just is tremendous. And I think one of the key things really with all this is just active engagement. The
Mm,
network actively engages projects, but also the agency. And at so many meetings I've been at
I like
recently,
that.
the discussion on relationships and how valuable relationships are, that's really the key to any social work because I may not trust the agency, but I know Yvette and I'm going to go see Yvette and I trust her. So then if she says, oh, let me help you with this, help you with that, and that is so invaluable, as are just the relationships among, between PHAC and groups individually or the whole group. Um, and one other thing, and then I'll turn it over to my colleagues, but one thing I really liked was the idea of intentionality,
Mhm.
where, and I appreciate looking at 2030, and if that is what happens, where the network sunsets, I appreciate your thoughtfulness in terms of the intention behind that and what happens, what are the most important pieces. And internally at PHAC, we've had discussions, and that's really uh, Jessica sits, she heads up our policy team. Olga's our acting director right now. And we wanted to invite those folks just so that at PHAC, if indeed we do say we're not doing the non-direct service things aren't going to be allowed, at
Mm,
least we're intentional about it because it's so important that PHAC understands the value of it
yeah.
and makes an informed, intentional decision. And I know, Blanca, you want to say stuff, and you know way more than me. I don't know. I
Mhm,
think we should invite other folks too, but I think I'll turn it over to you because
mhm,
you are the knower of all things, and you're very connected to the network.
mhm,
Thanks, Tim, and thanks, Sydney and Stephanie, for this presentation. I mean, it's every year you know, it just leaves me in awe of how much the group accomplishes. This is a group of representatives from across Ontario, from different areas and different communities, and the group changes. We have members who come back, new members, so it's always amazing to see the collaboration and the commitment, dedication to the work, to ensuring that the projects, whether it's a frontline staff, an ED, a manager, that they're able to connect and to come together to learn. And also, in the last few years, well, a couple of years, preparation for the solicitation, that was a big one. And the role of this network was just invaluable in supporting staff to even to understand, what was expected through this solicitation and guiding them through. And I know there were meetings, that were project staff came together to share challenges, but also best practices. And that is, as you saw from the presentation, uh, is something that doesn't just happen. We need, someone like in our case, it's Sydney, bring us
mhm,
together. We also have the coordinating committee. So it is, a time where we really don't know what to anticipate in terms of what it will mean not to have this network in 2030 if that is what happens. So I echo Tim, and how valuable it is to have the planning ahead and sort of sunsetting the work plan, but also looking ahead to what is needed for whatever it is that it's going to happen in 2030. So I don't know if Olga and Jessica or others have questions about some of the work of the network. And I also want to acknowledge the challenges that were raised because those are very real and something that we also, through the network, aspire to support in the best way that we can. So,
Oh,
anyone?
thank you, Blanca. I see a hand up. Kirsten.
Hi, Sydney. Hi, everyone.
Hi.
Yes, to prepare for the sunsetting of the network, which I'm so sad that is actually coming soon, like 4 years from now. But does that mean Web Connects will no longer have access to? Maybe a silly
It's a
question.
good question. And I don't know if we have the answer, but Stephanie, would you like to field that one?
Sure. As the agency who's holding Web Connects currently right now, we're talking about that, and that's definitely on our own 4-year plan as an agency. I am speaking to IT just to find out the sustainability of even holding it as a are we able to just at least have it there? I mean, it won't be coordinated by Cindy, obviously, but just to for the resources and for the contacts and some of the information that we have on there is just so great. So where else are we, supposed to put all that? So definitely, we're looking at sustainability. How much is that going to cost to just hold the site, even if it's maybe not someone coordinating it like Sydney? Are we able to still keep it alive? I'm not sure. Those are questions that we're having right now internally.
Thanks, Stephanie. Jessica. Hello.
Hi, thank you so
Hi.
much, Stephanie. Thank you so much for having us. And Sydney, really great presentation. Great to hear more about the work of the network. I know I've heard through Tim and Blanca and Rosetta, the important work that happens. Really liked the presentation. I always find for me, sort of storytelling helps to put things, solidify things and put things together for me. You mentioned, sharing of best practices and how the network
Mhm.
works together to solve problems. I'd love like an example or sort of a story if you had
Mhm.
one, just sort of to help kind of paint that picture about, the
Mhm.
important work of the network and how you've been able to work together to solve a problem or a best practice.
I have two sort of examples come to mind. The first one being a resource space on Web Connects that we call our Knowledge Center, where we sort of gather and curate a searchable listing of resources based on topic area like mental health or nutrition or things like that. And the resources go through a bit of a vetting process just to look for that sort of best practice and evidence-based. So that is something that's sort of static and on Web Connects. But I witness it I get to go to all the zone meetings. And when we hear the project updates at every zone meeting and people sharing what's going on and the activities that they're planning, I'm constantly hearing the back and forth of, somebody getting intrigued by an idea of what one project is doing over here and asking questions back and forth. So that's sort of my example of hearing that as well. I see Yvette has her hand up, and I might go to her because are you responding to the question, Yvette?
Yes,
Okay,
exactly.
yeah.
I just wanted to highlight, not only, as an administrator of the project, we sort of saw the impact of COVID that it had on our frontline staff.
Mhm.
And one of the things, as when I was the zone chair, I realized that there was a huge turnover in frontline staff. The learning curve was enormous. And I think that the reliance on the coordinating committee bringing information and best practices. And I'm thinking even as the demographics changed in our own community, having presentations on attachment practices across cultures, being able to, not work in a silo, but how do you leverage some of the years of experience and an amazing research frontline staff so that they're not recreating the wheel and they're actually being able to spend their time connecting with the families, that are in most need, as opposed to looking for specific curriculum and workshops and data to be able to present to these families. So I always say, how do we leverage the experience and the network to work smarter, not harder? And those lived experience. And we're seeing huge trends in turnover in the social service and not-for-profit sectors. That's the future. And I think that the coordinating committee really helps some of that heavy lifting in sort of being able to sort of align where that subject matter is, who in the group has connections. Some projects are very, very large and may be connected to institutions and universities that are doing frontline research that you can then leverage some of that across the project. So yeah, that's just a couple of great examples.
I have one more example in my head, but I want to check with Blanca and Bhupinder if either of you are responding to Jessica's question, or do you have a new question? Okay, Blanca, you want to respond? Okay.
Yeah, I have a bunch of examples, but I'm going to keep it to maybe three.
Okay.
So definitely, and Yvette said, COVID, uh, it was, I mean, we thought we were going to be on lockdown for 2 weeks, but, obviously it wasn't 2 weeks. And the network was just so nimble, and we were already set up. We were already doing things remotely. So the network, was able to connect people, to share practices that they were implementing in their communities. We were all new to what was happening. So those best practices were able to be shared very quickly, and then support to staff, staff feeling supported with information, and any communications that were coming out from PHAC, or if another or other public health information. So that's one example. The other one is infant mental health. It is a priority area for our projects, at the core of what our programs do. And through this network, we're able to be very, quick in sharing best practices, resources, bringing guest speakers, showcasing our very own projects and their work that they do. And anytime those events happen, there's always sharing of, what works for this community may work for your community. So it is a really great tool. And the other example is around maternal mental health. It's another area that we're, it's at the core of what we do. And this network is able to share. Recently, we had in May maternal mental health awareness. There's a World Day for that, and we were able to share a very unknown tool, the Mother's Mental Health Toolkit, and sort of, share expertise from one of our own network members, and build from that, what others could do in their communities. So those are three examples, but there's many.
Excellent. Excellent. Thank you, Blanca. And Bhupinder, did you?
Yeah, I can add. Blanca's covered what I was going to say, but the only other example I want to highlight is the support that just came together because over the reapplication process, the ISFR process. So although it wasn't sharing resources, it was really coming together to make sure we were all on the same page, or understood the application process in the same way, when it was quite a high anxiety-provoking time. And I know that session was well received, where we were really kind of coming together to just offer just drop in. If you have any questions about the application, at least we're all going to be on the same page, or we can kind of problem solve together. So I think that support is really important as well. And the only other example I really appreciate is when there's sharing of resources. I know that a while ago there was access female hygiene products. And those announcements really help, because, us as an agency supporting women, that came in. We had requested some of those overflow of resources, like the menstrual cycle products. So that's also resource sharing, and that becomes really important for us as well.
Thank you. Melanie, are you responding to Jessica? Okay.
Sorry, I was just going to agree with the ISFR process in general, and all the other things that Blanca mentioned as well. I've been with the network in this role for 3 years, and so it was my first ISFR process, and I wouldn't have been able to go through the process as confidently as I did without the network support and without those meetings. And then what Blanca was mentioning as well is the infant early mental health resources and the maternal toolkit. Like we know that communities don't do well when we work in silos. And so the network's really been supportive of supporting the breaking down of those silos to be able to share that information. And it just makes it our role to support like these families and these communities so much easier because we are working together and it's just a more supportive approach. So I just agree with what everybody else was saying.
Thank you, Melanie, for sure. Jennifer, I just want to Jessica, sorry. I just want to circle back to you, make sure, was there anything else around your question or any other comment you wanted to make? I
No,
see
that was
Olga's
great.
hand is up.
Yeah,
Okay.
thank you so much, everyone, for sharing your stories. It was really great to hear. And I can hand it over to Olga, who has a question.
Thank you. Olga. Oh, and we're not hearing you, Olga, unfortunately. At least I don't. Is any? No. And it doesn't look like you're muted.
No, not hearing you. Might be your audio because you've switched to Zoom
Yeah.
instead of Teams. Yeah, try your
That
audio.
can be a challenge.
Sometimes when you switch between the two, it can affect your audio. Yeah.
Yes.
No, we can't hear you. Oh, maybe you could message in the chat, Olga, or let me know and I could ask.
Okay.
I will say, not on
Yeah.
Olga's behalf, but just so everybody has some understanding, Olga is I'll call her the guru of EP&R, which is emergency preparedness response. So when things like COVID happened, she was out there on the front line getting things organized. FIFA, because that is a big event. Olga again is helping manage that for the Ontario region. And she's also filling in as our director at the moment. So lots on her plate.
Well, please feel free to pop a question or comment in the chat, Olga, or pass it on to one of your colleagues. We would look forward to hearing that. I also want to acknowledge Stephanie shared comment in the chat as well about her experience as a Northeast Zone member. Blanca?
I also wanted to add the work and the network related to truth and reconciliation. There is a big commitment from the network to increase knowledge awareness about what we can be doing to uphold the truth and reconciliation commitments. And so that's an area where there's a section somewhere on Web Connects where you can go and look for things that you can be doing, to build your knowledge about truth and reconciliation, Indigenous teachings, all of that. So that's another area where I think we're able to share best practices and build our own knowledge.
Absolutely. Thank you. And Olga, did your hand go up again, or is that from before? Sorry, I just wanted to check in. No, I thought maybe she got she's got a thumb up. Well, feel free just to, if you get your tech issue challenge, just to barge in and share what you wanted to say. Does anybody else have any questions or comments? I guess we're moving into wrapping things up here, but happy to hear from anybody else.
I don't know how to put my hand up in this thing. I never use
Okay,
Zoom.
well, hey, just a physical, that works.
And I was thinking hands up should have numbers. like a 1, 2, 3, 4, 5. There's a hot thing for the tech people. Now, one thing I thought was wonderful is just looking around the group. Gina, who I met, I don't know, 17 years ago or something when I first came to PHAC. Uh, but so many of you that I have seen either I've worked with you or I've seen your name forever. I appreciate the depth of knowledge and the
Mhm.
commitment and the work in community. And I will say Jess is a brilliant writer. So she's basically promised me that she will highlight how amazing the work of the network is. I'll just be open and transparent. What we're trying to do is say, hey, here's what the network does. These are amazing things. Maybe the whole country should do it, but we certainly would love to see it continue in Ontario and let someone at a high level at least make that decision one way or another. Because
Mhm.
the people do in government, it's like, and it's someone's opinion, right? Someone says we're not doing these non-service delivery things anymore. Someone can change. And I certainly don't want to promise anything. All I want to say is exactly what you said earlier. I don't know if it's Sydney or Stephanie, but that idea of being intentional and just to say, here's what this work is.
Mhm.
And it really helps PHAC as well as
Mhm.
all of you. So just wanted to say that.
I appreciate that. Um, I see Olga has put a comment in the chat. She says, I just wanted to say on behalf of Suchita Jain, our regional director, that senior management sees the importance of this work and the structure that allowed it to happen. She is committed to supporting our team and actively participating in any changes that may be coming and shape the direction to the extent possible. So thank you for that, Olga. That's much appreciated for sure. Well, I think our time is coming to an end this morning. So I just want to take a moment to thank you all for your time in coming and coming together and sort of celebrating with us in terms of what we accomplished this past year together in our work and getting excited about the year and the 4 years ahead. I want to really extremely super thank Stephanie for her time. It took a lot of, we did a lot of prep work together, and she's very thoughtful and committed and passionate. That certainly came through in what we were hearing from you. And thank you for your, not only in this presentation, but all the work you are doing on the coordinating committee and co-chairing. It's really appreciated. And a shout
Thanks,
out
Sid.
to,
Thanks,
you're
Sydney. But I'm going to
welcome.
interrupt you right there and say thanks to Sydney. Let's all be real here. Sydney put the slide presentation together. She never gives herself credit for this. So yes, I was a little part of this, but Sydney is the
Thank you.
one who, without her, and again, that slide, if I could highlight that whole slide, I don't know what we would do without Sydney. So it's been very super helpful, Sydney. So thank you very much for all the work and effort you put into it as well.
You're very welcome. It's my pleasure. Very much enjoy all the connections for sure. So thank you. Thanks, everybody. And I hope you have a wonderful rest of the day, rest of the week. We will be sharing this recording with our network members. I'll send a link out in the newsletter, and I'll send a link to Tim and our PHAC friends who are here. And I look forward to seeing you at our next event, which is a father focused event coming up next week. We're really excited about our speaker, Ed Goff. If I was on the ball, I'd have the link to the registration in front of me, but I don't. But hopefully you've all seen it in the newsletter, and that we'll get to see you then. So please send the slides to. Noted. Got it. We'll do it, Tim. Take care, everybody. Have a good rest of the day, and we'll see you next time, wherever that is.
Thank you so
Thank you,
much.
Sydney.
Thanks,
Thank
everyone.
you. Bye-bye.